Hi, I'm Kelly Weiland. I'm a 10-year breast cancer survivor. My breast cancer experience began in 2003. It was Super Bowl Sunday, I remember that very well, and I woke up and I rolled over and I felt a lump in my breast. And I wasn't that concerned about it. I was, a little worried. Not having any family history, I just decided to go to the doctor the next day to see what it was. And I went and saw my OBGYN, and she tried to aspirate it thinking it was a cyst. And nothing came out, so she immediately sent me for a mammogram. Got the results back that day, and she said it was very suspicious and sent me to a surgeon who I saw the same week. And the surgeon looked at my mammogram and knew right away it was cancer and told me that. She said, we have to go ahead and biopsy it anyways, but I can tell you right now it's cancer. So I had the biopsy like the day after that, and 2 days later they told me I had cancer. The doctors told me it's very serious, we have to treat it very aggressively, and so I started chemotherapy a couple weeks later after I recovered from the surgery. Went through, your standard chemotherapy at that time, which was I had 6 rounds every 3 weeks, and then that was followed by radiation. But as I started my chemotherapy, due to my age, I was 33 at the time I was first diagnosed, approaching my 34th birthday, and they said, my doctor first talked to me about genetic testing. He said, it wouldn't be a bad idea to find out if you carry the gene, because your cancer was so advanced when we found it, and we're finding, sometimes in younger women that could be, because of the gene. So I went and talked to the genetic counselors at St. Thomas Hospital and found out everything and how it would impact me and my family. So I went ahead and had the test, and it came back that I carried the BRCA2 gene. And I immediately shared all the information with my brother and my sister. My sister went ahead and got tested. She found out that she did carry the gene, and it was very troubling to her because she was like me. She had 2 very young children. Didn't know which way she wanted to go with it, but she went and sought, I think she had 3 opinions before she decided what to do. All 3 of them told her the same thing. You have an 86% chance roughly of getting the disease by the time you're 70. So she thought about it really for at least 1.5 years, I would say. They told her, you don't have to have a double mastectomy, but you'll have to be watched very closely. A minimum of having mammograms every 6 months is what they told her. And also with that gene, you have the increased risk of ovarian cancer. So they talked to her about that. When I found out I carried the gene, I immediately talked to my doctor about it because of the ovarian side of it, and they immediately said, you need to have your ovaries out at a bare minimum. They said you don't have to do the full hysterectomy, but at least have the ovaries out. So I discussed with my doctors, and I did proceed with having my ovaries out. 2 years after my diagnosis, my mom she had symptoms of breast cancer, and she went to the doctor and she was diagnosed with it, and she decided to have a double mastectomy, and she had to go through chemo and radiation. Right about that same time, my sister, knowing that, she decided to go forward with having a double mastectomy as a preventative means, since I had the gene, my mom had the gene, and both of us already had cancer. She felt very worried about it. There is so much to consider, once you have that gene, it doesn't just impact you, it impacts your entire family. The hardest part of this experience is just what the gene means to my children. It's been very difficult looking at my daughter growing up, knowing she's now developing and what that means to her. She'll soon be 12 years old, and I've prayed ever since I was diagnosed that they'll have a cure by the time she's old enough. But it just means for her, once she's 18, she'll need to get screened, and we'll have to talk about whether it's something that she, wants to find out whether she has it. I'm going to share all the information with her and just see what kind of choices kind of guide her, have all the tools available to be on the lookout and to fight anything that may come along. Even if there's not a family history, depending on your age and, just your personal beliefs, I recommend you talk to a genetic counselor. It may be something you're not even considering, but I would listen to them and what they have to say about it and see if it is something that you would want to even consider. And they'll explain how it impacts everyone in your family. And to me, knowledge is power. So if you can find out whether you have the gene or not, you can then take steps to fight going forward. Great if you don't have it, but if you do, there's other steps you have to take to make sure that you can stay as healthy as possible.